Okay, well, thank you for that introduction. I am happy to be here. And as Will said, I have a lot of clinical interests, but I do love equine nutrition. It's become something I've just become more and more passionate about the longer I've been in practice. And I particularly like working with older horses and horses with complex medical cases, um, like endocrine diseases. And I really, really hate laminitis. And nutrition is an important part of preventing and managing that. So, with that, let's get started. My slides will advance here. Here we go. All right. I do want to just briefly say I don't have any affiliations with any brands of feed or any particular supplements. Um, I will use some photos of different feeds and I'll use some examples. They're really just for illustrative purposes. I'm not endorsing any one product here tonight. I have done some nutrition training through Legacy Equine Nutrition. So I do have a link to Rachel Motte's page at the very end in the resources. So just disclosure there. Um, and like Will said, I can't really give any specific medical advice or nutrition advice this evening because that does require a valid VCPR. But I will be giving general guidelines, and hopefully you'll take away some things that you can apply to your own horse this evening. So these are the topics I'm going to try to cover tonight. The problem with having a passion for a subject matter is it's hard to cone it down. And I've gone through these slides a million times trying to find just the right things to say, not too technical, not too broad and vague. And hopefully I found the sweet spot, but we'll see how it goes. So we're going to talk about how we define senior horses. So we'll do that first. We'll talk about the impacts of aging, and then we're going to talk a little bit about feeds that we might use when we're formulating a plan for feeding an older horse. And then I'll give some specific scenarios looking at different aspects of senior health. And we'll talk about how to use forage alternatives and when to pull long stemmed hay. And then the very last two slides, I've got some resources for you with textbooks I like and some other places that you can find more information on nutrition. So defining senior or aged or geriatric, these are all terms that get thrown about when we're talking about horses as they age, just like with people as we age. So there's a couple different ways to look at this. One is just by the chronologic age, right? From the date of birth to today, that's the age. And that is absolutely accurate, but it doesn't necessarily describe how these animals' bodies change. And so it can be a little bit misleading because a 15-year-old Arabian and a 15-year-old Belgian might not be aging at the same rate. The physiologic age, I think, is a little bit, gives a little more full picture because this is really more of our functional age. So when does that capacity to perform really begin to diminish for a particular animal? And there isn't really one age that defines that. But when we talk about geriatric, really the widely accepted age now is about 20. If you read any of the earlier literature, we used 15 or 16 to define that, but it's gotten pushed to 20. So the other way that we think about age is by owner perception. So how does an owner think of their horse or any horse in their barn as old? And in surveys, that number has landed at 22. So these are surveys in the early to mid 2000s. And in the 80s, people used to say 16 was old. So if you were 16, you were a senior horse. And now we're saying 16, that's nothing. So 22 is the owner perception. And then when we look at trends in age in the US, our most recent USDA surveys show that over 11% of horses in the country are over the age of 20. And a separate survey estimated that about 25% of those horses are over 30. So horses are living longer and they're living really well, thanks to advances in medicine, in feed for sure, and I think an owner's willingness to hang in there for the long run and really put money and energy and time into helping horses live into these ripe old ages. So 30 is the new 20. We're going to talk a little bit here just about the impacts of aging. So these are probably the four most common questions or complaints I get when I'm working with my clients. So muscle loss, weight loss, dental disease for sure, and we'll touch a bit on that, and endocrine disorders, and we'll touch on those as well. And I've got a variety of reasons why these changes happen as horses age. And people have some real parallels too. And if you read the literature, they often start with, here's the evidence in people, and this is how people change. So some of us can relate to some of these changes, not the weight loss, but the other one. So these are important, and they all can sort of play off each other, right? So we can get muscle loss and weight loss due to PPID, or we can have weight loss due to dental disease. So there's a lot of interchange in why one thing might lead to another. And then a whole bunch of other more deep impacts of aging on immunity. You'll hear this term immunosenescence, which tells us the immune system is not as competent. Maybe we're not getting as robust a response to vaccination, or maybe this is why we're getting some susceptibility to infection. We also have more chronic inflammation. So you might see the term inflammaging thrown around. And we know that people and horses can live in a more chronic inflammatory state as they age. So especially when we think about horses that have been athletes, and maybe we're getting some chronic osteoarthritis or some foot pain, like from navicular syndrome. So that can lead to a chronic state of inflammation. And these can contribute to other age-related diseases. Thermal regulation, I think, is interesting, especially, I mean, it's a warm January day, but it's still January in Minnesota. When we think about horses in extreme weather conditions, so really, really hot, really, really cold, or when we're exercising at high levels, some of our horses will lose that ability to really control their body temperature under those conditions as they age. And that happens for a variety of reasons, but it's just important to consider when we've got these extremes like we had not too long ago, in how we manage, are we blanketing? Are we feeding additional hay? Are we providing, horses that maybe don't normally come into a barn, maybe we bring them into stalls. So just things to keep in mind as horses age. All right, so before we talk about some specific ways to feed horses, I want to talk about some of the feeds that we have access to, because I think this is some of these feeds are some of the better changes in the feeds available that have just helped these horses live longer and longer. I mean, I think we can manage horses now in ways that we couldn't 10 or for sure 20 years ago, because we just didn't have access to some of these products that really help these horses get the nutrients and the calories that they need as they deal with some of these impacts of aging. So a couple things before we launch into forage here. I do want to just say that the recommendations I'm making throughout the presentation here are for adult horses, and we'll separate the healthy ones from maybe the not as healthy. So none of these recommendations apply to growing horses or to pregnant or lactating brood mares. So they're kind of a separate challenge maybe. So forage we're going to talk about a lot. It is the basis of the equine diet, right? These are grazing animals. They are trickle feeders. They are designed to be sort of eating and resting throughout the day. So we're going to come back to this concept of forage first over and over again today. So I'm sorry if you hear it a lot. It's really important. And forage, so we're talking the same language, that can be any form of forage. And when we look at numbers and we say we want to feed, X% of the horse's body weight in forage, that's all forms. So that can be pasture, that can be hay, that can be processed products like chopped hay. I'm sorry, I botched the image here, but it can be our hay cubes, hay pellets. You can see the photos there. And then we can also consider some forage substitutes. And we'll talk about these when we get into some of the horses with dental issues. So we can use beet pulp as a forage substitute. It's a great source of, you can think of it as like prebiotic fiber. We're not going to substitute 100% of our hay or pasture with beet pulp, but we can use up to 50% of our forage. We can replace that with beet pulp. And then there are some commercial hay stretchers on the market too. And I put this under substitutes rather than in processed forage because some of them are just hay pellets and some are more fortified. So you have to read labels to determine the best way to utilize a hay stretcher. But we've got loads of products out there now that really make feeding these older horses with poor dentition a whole lot easier. All right, and then ration balancers. So when I think about approaching a diet for an adult horse, I'm first thinking of the forage. We're going to evaluate that first, and then I need to fill in the gaps. And usually what I'm going to fill those gaps in with, or I'm going to consider first, is a ration balancer. And I think this balancers are one of the greatest inventions in nutrition that we've had in the last decades. They are very concentrated forms of basically like vitamins, minerals, protein. So Rachel Motte, if you all know her, or some of you know her, she says a ration balancer is like a multivitamin with a shot of protein. And that's how I think of it. So they're nutrient dense, but they're low in calories and they're fed at very low feeding rates. So usually 1 to 2 pounds a day. So if you're at the feed store and you're looking at all of your options, these obviously say balancer on the bag. But if you're not sure, if you turn the bag around and look at the feeding instructions, you're going to notice that they're fed at very, very low rates of that 1 to 2 pounds a day. So that's going to be maybe your first clue, maybe your last, but that's going to tell you that you're not dealing probably with another type of supplemental feed. Sometimes balancers don't provide enough calories for a specific animal. And so then we can go to a supplemental feed, and which is basically, in my mind, a bagged feed that's not a balancer. Some people will refer to these as concentrates. Some might call them grain. And I put that in quotes because sometimes they don't really contain cereal grains or not very much cereal grain. So grain to me is sweet feed, but some people consider anything that comes out of a bag grain. So the catch with these is you have to read labels to see who your intended target audience is, right? So they're going to say on the bag, meant for feeding, adult horses at maintenance or adult horses in lactation or whatever. You're going to know from the bag who they're intended for. And then you can read the feeding label to see what the instructions are to determine how much you need to feed. And these have a higher rate of feeding than a balancer typically. So depending on the feed, 2 to 6 pounds a day. So we're going to determine for each individual animal, which is the appropriate feed, whether that's a ration balancer or one of these supplemental feeds, and then how to use it. And then there are complete feeds. Again, another outstanding invention in nutrition. So complete feeds have the fiber built into the feed. Hence, they can be fed without hay. So that's what makes them complete, that the fiber is already built into the pellet. So these are usually really optimized for absorption. They are going to have high quality nutrients. They're going to break down easily, either by soaking them with water, or the horse can kind of gum them down if they don't have very good teeth. They can be fed with forage, so with pasture, with hay, as a supplemental feed, or they can be fed all by themselves without any other forage. Now you can imagine your feeding rates are going to be very different if you're feeding it with hay or you're feeding it without hay. The key here is that many senior feeds are complete feeds, but they are not all complete feeds. So this is another place where we really have to look at the bags, and we're going to do a little sleuthing here. So if you look at these two products, we have Equine Senior Active here, and we have, hopefully my cursor is visible. We have the Purina Equine Senior, just the plain senior in the red bag on the right. And then this is just another example of a complete feed, which is very easy to see because it says complete right on the bag. But if we, oops, sorry, read the labels. If we are trying to determine, because it doesn't say complete, it's not obvious, it's not a giveaway, we need to look at the back. And if it has instructions for feeding with or without hay, then it's a complete feed. If it doesn't have instructions for feeding without hay, it is not a complete feed. Okay, so digging a little deeper with these two, I just want to show you that the Purina Equine Senior has instructions here for feeding without forage and feeding with forage. And your Equine Senior Active only has directions for feeding with hay or pasture, but it will tell you right here. You can see it tells you how much hay to feed. And as does this feeding with forage, it will tell you approximately how much to feed. So you really need to read your labels and don't assume that all senior feeds are complete. And many of them that aren't will even say that they're not complete feeds or that they are not intended for horses with poor dentition. So it's worth your while to dig a little deeper and flip that bag over and read the label. All right. And then some horses need a little extra help with their calories. Many do not, but some do. And we have fats for that. And fats are a great calorie source. They're great because they're calorie dense. They don't provide any other nutrients, so you can add them without having to worry that you're imbalancing something else in the diet. They also can be used to keep your meals small. So if you have a horse that maybe doesn't eat a lot in a setting for whatever reason, if you're adding a fat, you can get a small amount of volume that packs a big punch. So fats are great for that. And when we think about our patients that are carbohydrate sensitive, so can't have a lot of starch and sugar in the diet, and we're trying to avoid cereal grains, we can take those out and we can replace them with fat. Now we have to make sure our nutrients are being covered, but we can use fat in place of some of our more carbohydrate rich feeds. Two things I want to caution you about with fat. One is that they're not always very palatable. So you have to really start with a small amount and work your way up. And the other is that some of our fat supplements, especially the ones that are pelleted, have a kind of sneaky amount of starch and sugar in them. So again, you want to read labels and look for starch and sugar, or sometimes they'll be listed as NSC, non-structural carbohydrates. Look at those numbers. If you've got an oil or usually powders, like this is a ground flax here in the upper right, those are going to be pure fat. The flax will have a little fiber too. But when we get things that come in pelleted form, now we're adding ingredients to make the pellet. So we have to watch and be very careful. I've gotten caught with that, not realizing that some of these pellets are upwards of 22% non-structural carbohydrates. And then last thing, when we're feeding fats, especially if our levels of fat inclusion are going up, we want to think about antioxidant support because fats get oxidized and we can get some free radicals formed with the oxidation of fat. So vitamin E at this feeding rate here at the bottom is recommended when we're getting supplemental fat added to the diet. And then lastly, I'm going to just say a couple words about supplements. I know there are a lot of questions. Everybody likes to show their love with supplements. And just thinking about supplements, there's not really a definition. You can't find a unified definition of what a supplement is, but usually they're considered a substance that's supposed to provide something beyond what's provided in the diet or beyond meeting a requirement. And some of them have very reasonable claims like supporting a healthy inflammatory response. And some have, wild claims. What they can't claim is treatment. When a supplement or a nutraceutical starts to claim treatment, then it becomes a drug. So just watch your labels again and see what the claims are. These are not regulated or very poorly regulated in the United States. And most of our supplements out there, and there are gazillions of them, have very little data to prove safety or efficacy. And I will say most of the time, my stance is, they probably won't hurt, but they may not help. But you do have to be careful, especially if you're using multiple supplements. So what I usually advise when you're looking at supplements is to start with the diet, right? Because no supplement is going to compensate for a poor diet. So we have to make sure that we've got all of the requirements met, that we're really trying to meet the needs through the diet. And then decide, what's the goal that you're trying to achieve? People will say, well, what's a good supplement for a senior horse? Well, what's the goal? You need to have some sort of black and white goal that you're trying to achieve with a supplement. And then you really need to have some sort of objective parameter that you're going to measure success by. Otherwise, people often start these supplements and then they don't know if they're doing anything, but they're afraid to take them away because something bad might happen. So before you go down that supplement road or roller coaster, try to set some goals and then think about how you'll measure if you're succeeding with that supplement. All right, so that said, let's talk about how we're going to provide the feed. So first of all, if I get you to do one thing after tonight, let's weigh our feed. So this sounds very elementary, but I still do a lot of consulting with people who, when I take the history, tell me they're feeding a scoop of something or a cup of something. That's fine as long as you weighed it before it went in the cup or the scoop. So feeding by volume is not a very accurate way to feed. When you read those labels and when we talk about what we want to feed these horses tonight, we're going to talk about how many pounds to feed of hay in particular, but also our ration balancers or supplemental feeds. They're meant to be fed in pounds. So you want to weigh your feed. Here's some examples of different scales. They're inexpensive. And then you can use whatever vessel you'd like. So if you have a cup or a scoop or an ice cream bucket, those are all great. So you can put your ice cream bucket on your scale, put your feed in there that you've been feeding, see where you're at. Then look at your label and say, is this what I'm supposed to be feeding? And if not, then bring it up to that level or toss a little back into the bag. And then you can mark on your vessel where that 1 pound or 2 pound or however many pound line is. And then you can still use the vessel and you don't have to weigh it every time. But we want to get a weight and we want to get a visual so that we're feeding that, whatever feed you're using, appropriately. The densities of feeds are all different. So, a Triple Crown low starch is not going to weigh the same as a Triple Crown Senior Gold. And so that's why we have to weigh them, because we can't just assume that a pound of one, if it fills the cup to here, is going to be the same as the other. And some of the feed companies have tools for you to use to figure that out. There's cups here that Purina will dispense that has markings for where a pound is of the different feeds. I know Triple Crown puts the densities right on their website. I'm not sure if Trina has densities, but kind of some of the bigger manufacturers are going to help simplify this for you. But definitely start weighing. And we'll talk about like how to feed some of these horses tonight, but I can't impress upon you enough how important it is to have a starting place. So I really highly recommend, and if I'm working with someone, the first thing we're going to do is weigh the current feeds. We want to know how much hay in pounds, if we can. If the horse is on a round bale with its herd mates, obviously I can't measure that, but we can measure what the horse is fed if it comes into a stall for a meal. So we can weigh the hay, we can weigh the concentrates, and then we know what the baseline is. So if we have a horse that's overweight or underweight and I weigh things, that right there might answer some questions. So weigh feed. And then we could have a whole nother session on how to evaluate horses. But the other piece is to look at the horse to get an estimated or calculated weight. And that's just a little picture on the left of where we're going to measure for those. And then we want to do a body condition score. And those two together are going to tell us if that horse's weight is appropriate. So if I have a horse that weighs 1,300 pounds, this looks like a warm blood. He probably does weigh about 1350, I bet. If he's a body condition score of 9 out of 9 and he weighs 1350 is not an appropriate weight for him. If he is a 5 or maybe even a 6 out of 9 at 1350, then I might be pretty happy with his weight. So the weight alone is great for calculations, but to know if that's appropriate and if we're going to stick with that or set a different goal, we need that body condition score piece. And this is something, if you haven't done, you can absolutely learn how to do. And at the end in that resources slide, guess what? There are some tools there for you. Okay, so last thing before we start talking about how to actually apply some of this. When we talk about feeding horses, you'll see this term DM or dry matter basis thrown around a lot. And just so we're all on the same page, dry matter basis means we're just removing the moisture. So even hay has some degree of moisture. We don't always have to get this granular with it, but it can be really helpful if you're comparing one hay to another, or you're trying to compare feeds. We're talking apples to apples by taking the water out, and then we understand what we're left with in a dry matter basis. It's also important to remember that when we look at the NRC nutrient requirements for horses, all of those requirements are set on a dry matter basis. So if I'm trying to compare a diet to the requirement, I need to look at the diet on a dry matter basis to compare those apples to apples. So it's also important when we think about soaking feed. So we'll talk about when we can do that a little bit later. But if we soak hay, we are adding water to that hay. So our dry matter is going down. So we might need to actually feed more hay to compensate for that loss in dry matter. And for those of you who really like to get into the math, this is just an example. 92% dry matter is a pretty good average for grass hay. So if I have 10 pounds, sorry, I lost my pound sign there, of hay at 92% dry matter, then I am feeding 9.2 pounds of dry matter. And reverse, if I want to feed 10 pounds of dry matter, I need to feed almost 11 pounds of that hay. So it's a good way to think about, do I have to get into the weeds on the math? Probably not, because I'm going to talk about a range of feeding hay. So if I'm a little worried, I can always, and it's not a horse that's overweight, I can probably, I have a little wiggle room to work with if I'm just feeding dry hay. So if I want to feed 10 pounds on a dry matter basis, yeah, maybe I add another half pound or a pound to that, and I figure it's going to work out in the wash. So sometimes I'll do this at the very beginning of a feed plan, and then we get a little bit more flexible with it. Okay, so we're going to set a goal here of feeding horses to a body condition score of 5 out of 9. Will I accept 6? Sure, especially if it's an athletic horse, it's in work, it's doing well, it doesn't have any other issues where I'm worried weight might be exacerbating, like an osteoarthritis. 4, getting a little lean. So I'd rather have them at 5 than 4, but for most athletic horses, I'll accept 6. And then I'm going to start with my forage because that is the cornerstone of my feeding program. So our average goal is to feed 1.5 to 2.5% of the horse's body weight on a dry matter basis. So again, if I've got a 1,000-pound horse, I'm going to feed between 15 and 25 pounds to come into that. Now, that's as fed. So if I really want to do the math, I can figure out exactly how much to feed. But since I'm giving you a range, I'm not that worried that we have to start doing math on every slide here. I do want to make sure I'm providing that forage in a manner that is consistent with the grazing, trickle feeding nature of this horse. So if that horse is not on pasture, I need to think about how I'm feeding my hay or whatever other forage product I'm feeding so that it's not going hours and hours with an empty stomach. So starting with forage, figuring that out first. And then we know that all forage, even pasture, has nutrient gaps. And that's going to depend on what plants are growing out there, what time of year it is, what part of the country we're in. But I'm going to, in general, strive to fill those gaps in with a ration balancer. So if I've got a horse that's already at a 5 or a 9, I can probably meet that horse's calorie needs with forage alone. But I'm just going to need that ration balancer fed at that low feeding rate, 1 to 2 pounds a day, to make sure that I've got all of the nutrient requirements met without adding a whole bunch of extra calories. Now, if I have a horse that's a hard keeper and I need those extra calories, that's where I'm going to reach for one of those supplemental feeds. So I might choose like a low starch feed, or I might feed like that safe choice maintenance that was on that earlier slide. I'm going to pick something that is going to be appropriate for the horse's age and work level. I'm going to feed it according to the package so that I make sure I'm feeding enough. And then if I need more calories, I can reach for a fat. Or if I need just a few more calories, I could stick with my balancer and add fat to that. So there's a number of different ways that we can achieve those goals. And then sounds simple, but we want to make sure with all of these diets that we talk about tonight that we're providing fresh, clean drinking water and a salt block around the clock. And salt does not need to be overcomplicated. Horses will self-regulate. They will seek it out when they need it. A white salt block is really all you need. If you want to go for pink Himalayan, go for it. I have had people tell me their horses like it better. That's fine. But I would say if we're looking at like what are the foundations, a white salt block is just fine. Those pink mineral blocks don't really provide a lot of minerals. The horses go to them for the salt, not the mineral, and they are so dilute because they don't want to kill anybody with an overdose of selenium that they really don't have a lot of minerals. Okay, now I promised we would talk about the older athlete. And really, if you've got a horse that is 16, 17, 18, so it's in that aging sort of range, maybe not aged, but it's still in good condition, it's working, he's doing well, we're not going to treat him a whole lot differently than we would a 15 or 14 or 13-year-old horse that's in work. So when we think about what changes with work from the base diet that we just talked about, we go to the NRC where they have very specific definitions of different work levels. So light work, moderate work, heavy, and very heavy work. And I will say, I do think people tend to overestimate the amount of work their horses are doing. So just if you get a hold of this, you can find those definitions. They're really helpful because they break it down into how much, like how many hours of work, how many days a week, the intensity. So are we looking at like walk trot? Are we looking at walk trot canter? Are we doing gallop sets? Are we racing? Are we doing endurance work? So it gives you even heart rates. So it's very well defined, and that's going to get us in the ballpark. So we're going to evaluate that, and then we're going to determine how much have our needs changed based on work. So what's our calorie requirement? What do our nutrient requirements look like with the level of work a particular horse is doing? And then because their GI systems are aging, because we may start to see some of these other impacts like challenges with thermoregulation, I want to pay attention to the quality of the nutrients I'm providing for that animal. I want them to be bioavailable. I want them to be able to assimilate them and use them, especially when we think about protein. And this is where, I wish I could have a hay analysis for every flake of hay a horse ever ate. I really, really strongly encourage you to do that. But this is where we could also think about, in very practical terms, if you're concerned about your hay, like maybe just from a visual inspection, you have questions about how digestible it is, if it has very, thick stems, um, very low leaf to stem ratios. This is where we can turn to those bagged forages to maybe supplement a little bit. And there's a number of different ways we can use it. We can just use them like as a meal. I'll talk in a minute about a different way, like to time those. But especially with our hardworking athletes, some inclusion of alfalfa can be a really good thing. It's an excellent source of protein, and we don't have to feed large volumes of it. It also has a little bit higher calorie density than our grass hays. So if we've got a grass hay as the base of our diet, we can use some pelleted alfalfa to kind of round things out, especially when we're thinking about that protein. All right. We know that athletic horses are at higher risk of forming gastric ulcers than our non-performing horses. There's a lot of data on populations of horses that have higher rates of gastric ulcers, and it's no surprise that it's performance horses. So we want to focus that way that we're feeding to make sure that we're spreading out forage over the day. We want to make sure those gastrointestinal systems and that stomach, we don't need it full, but we want feed going through on a regular basis, just like a horse would when it's out grazing. So guess what? Having them out grazing is ideal. So if the horse can tolerate pasture, it doesn't have any other issues that make pasture, come off the table, then pasture is great for reducing gastric ulcer risk. When we are feeding cured forage, hay, we want to just make sure that we're stretching that out so that it is provided over a 24-hour period. Now, that might only be when the horse goes to a show or goes, you know, horse camping, trail riding, what have you, or in the winter when we don't have pasture. So it might not be a year-round situation, but just keep in mind when you're feeding hay that we want to also try to mimic that natural grazing mechanism and having feed going through the GI system as many hours as possible. A lack of water has also been documented to be a risk for ulcers. So I'm just going to say it again. I know it sounds silly, but we want to make sure horses have water. And that doesn't mean that you're not providing water. It might mean that you've got a horse in the herd that isn't allowing the other horses to drink. So it could even be just a management issue. Or you've got a horse that comes in, if he comes into a stall, we've all seen these guys probably who suck down their whole bucket. So if we're not aware that that is the drinking behavior of that horse, the bucket might not get refilled. So just paying attention to how the horse is drinking water. Some horses like water in their stall in a bucket. Some horses like it from a trough outside. Some horses are terrified of automatic waterers. So it's important to get a feel for what your horse likes. And they've actually done studies too to look at water temperature and where those sweet spots are where horses will voluntarily drink more water. So this is also another place where we can use those alfalfa pellets. And I know I said it again, alfalfa. It's controversial. I know people have strong feelings about alfalfa, and some people love it and some people don't like it. I think for not all horses, but for many horses, alfalfa is a great choice, at least as part of the diet. So I like to consider alfalfa pellets a small meal, like a pound, before the horse is exercised. So you can feed them some alfalfa pellets while you're grooming and tacking up. They can have a small meal that's going to provide a little bit of that fiber mat in the stomach. It's going to protect against splashing on the squamous mucosa. And then you've got a little bit of extra calcium that can also neutralize the pH of the stomach acid. There are also some guidelines for starch when we talk about gastric ulcers. So the published number is 1 gram of starch per kilogram of body weight per meal. So that's 454 grams for your 1,000-pound horse. And I think there's mounting evidence that we probably need to even stay under this. And one way to accomplish that, especially if you've got a horse, maybe not in the geriatric range, but if you've got a younger horse that's in really intense work and you're needing to feed a higher starch feed, is just breaking it up into smaller meals. So this is a per meal guideline. So if you just feed smaller meals more frequently, you're feeding less starch per meal. So it can be just as simple as that. If you know you need to feed 8 pounds a day of a feed, and that's going to put you over that 454 grams. If you feed 2 meals a day, then feed 3 meals or feed 4 meals and just get the per meal grams down for each feeding. And then vitamin E is really important, not only as an antioxidant, which we talked about with the fat supplement, but also as it's really important for muscle development. And since working horses are constantly breaking down and remaking muscle, we need to make sure that if we have horses that are not on pasture, that we are testing serum levels and then we can supplement appropriately. All right. Also important, just to mention, I know this is a nutrition talk, but it's all tied in. We want to make sure that we're maintaining our routine health care. And we're talking about athletes, but this really applies to all of our horses as they age. So we want to make sure that we're maintaining our vaccination schedule. So I get a lot of questions, especially when we get horses into their, deep into their 20s about, do I still need to vaccinate? This horse has been vaccinated his whole life. And the answer is yes, because of that immunosenescence, and we know that that chronic inflammatory state can lead to less robust response to vaccination. It's important to maintain those vaccines. And we don't have titers well worked out yet where we can draw blood and determine specifically for your horse if we need to continue to vaccinate or if we can stop. I hope we get there. When you look at the literature on whether aging horses really utilize nutrients the same way that younger horses do we have some issues there? The studies are old, and the belief now is that maybe because we've got better tools for managing parasites, not just better drugs, because the drugs haven't really changed, but doing fecal egg counts and doing strategic deworming, that we've got, I think, a more, I don't want to say global, but at least national population of horses that probably have better immunity to parasites and are not carrying these really high parasite loads. And so it's important, though, to not just blow it off and say, great, things are better these days. They are, but let's make sure we're still doing our fecal egg counts and we have a good parasite management plan so that that doesn't become a factor. We're going to talk more about teeth in just a couple slides, but making sure that you're having those oral exams done. I would say, a good average is to consider it on an annual basis. And then you'll know if you need more frequently. Some horses need less, but as they age, I think annually gets to be more and more important. And then for our athletes, we want to make sure that we're addressing any lameness issues, especially those chronic kinds of lameness like osteoarthritis or navicular syndrome. And then consider, having some lab work done at your vet visits. Don't have to do it twice a year, but once a year, just doing a CBC chemistry, because we do see sometimes, horses can develop some liver or kidney issues as they age. That will be caught on a chemistry. And then again, horses that don't have access to pasture, like to encourage testing vitamin E. So we talked about feeding healthy older horses and athletic older horses. So how do we know when we need to intervene and do more than some hay and a ration balancer? I think this is not an exhaustive list, But if you're noticing changes, right? So your horse has been doing great for years and years and years, and all of a sudden you're noticing they're less active. And that could be they're less active out in the pasture. They're not interacting with their buddies the same way. Maybe they're losing their status in the herd, or you're noticing a decrease in energy when you're exercising. That could be due to orthopedic issues, or you might see that separately. Noticing any dropping of the feed, quitting, or if you're seeing undigested feed in the manure. So very common as horses lose their grinding capacity to see bits of, hay that aren't completely broken down, so they're a little bit long, or whole oats. If the horse is getting oats, you'll see that just passing through completely undigested. So weight loss, all of these are really good, like red flags, to determine that maybe we need to have an intervention. So weight loss, as I said earlier, is a really common issue as horses age. And I see a lot horses that were very easy keepers all of their lives suddenly are not. So from, fall, the blankets go on, blankets come off in the spring, and I can see ribs. What happened? So that is a very common scenario. And first thing we have to do is really just try to determine what the underlying cause is. And that's where, we're going to pull out those scales and we're going to go through and say, okay, what is this horse eating in a day if we can measure it? So sometimes we can't, but if we can, let's get a good baseline on what the horse is taking in. If the horse has lost weight and we weigh the hay or weigh the feed and we realize, oh, maybe we haven't been giving enough groceries, easy to solve. But we also want to look at those teeth because we know horses are outliving their teeth. Again, pulling a fecal egg count, looking at the herd. So has there been a new horse added, or as the herd has maybe shuffled, do we have a boss that's preventing maybe this older horse or older horses from getting access to feed? So we might have to look at not what we're feeding, but how it's being fed and who's got the rights to the feed. Evaluating for pain. So pain can be sneaky, and that can be oral pain, that can be orthopedic pain. We know that horses that have hock pain can, I don't want to say suffer silently, but you might see weight loss, you might see loss of top line, things like that that are secondary to that pain. And even though they're not overtly limping, they still have a painful condition that's setting up for weight loss. And neck pain is an important thing too to consider because horses can get osteoarthritis in their necks. And for those horses, sometimes it is painful for them to graze or to eat hay off the ground. So we have to consider all sources of pain. And then, of course, changes in metabolic status, which we'll talk about in a little more detail soon. So in these thin horses, we're going to identify, hopefully, some of the underlying causes or one underlying cause, and then we're going to correct what we can. So dentistry is tricky, right? So we can remove the sharp points. We can make the mouth more comfortable so that the horse can do the normal figure 8 chewing pattern, but we can't put tooth back on. So the oral exam is really important in these guys because we want to be able to see what is going on in that mouth. So, we talk about floating a lot, and floating is important, but it's only part of the picture. And as horses age, I think the exam becomes the more important part of that picture because we want to see, are there loose teeth? Are there missing teeth? Do we have abnormal wear? Do we have pain in the incisors? Do we have spaces in between the teeth where feed is packing that can also set us up for sinus infections? So that exam is really important. And so don't underestimate the value of an oral exam. Talked about fecals, pain management, and then treating underlying diseases like PPID. We'll get into that, as I said, in just a minute. And then looking at that management piece. So we're going to maybe change up where the horse is fed or how the horse is fed. Does he need to be separated? Or do we need to have, some people have like a fat paddock and a skinny paddock. So do we need to do some shuffling of the deck there? And then consider elevating feed. So if you've got a horse that seems like, oh, you know what, he seems like he's painful when he eats from the ground, but if I hold the bucket, he'll eat very willingly. Then figure out how you can elevate the feed for him. And then we're going to just provide those calories. So we want good quality groceries for these thin horses. So again, hay analysis is going to answer a lot of those questions. We want to make sure it's a high quality forage. We can add fat. Obviously, a ration balancer will help make sure that we've got the nutrients met. But we want to achieve as much as we can with the forage first. So good quality protein in the forage, 12 to 14% is a published target for the aging horses. One thing that is always telling to me too, why I've got a picture of hay and a picture of a pasture, is, pasture is great, right? So if we've got a thin horse that can have pasture, can tolerate the sugar, doesn't have other underlying issues, then pasture is a great way to provide everything in a natural way. But when I see a horse that's on a really nice, well-maintained pasture and he's thin, then I have to ask myself why. Why is that horse on pasture? Even if it's not 24 hours a day, let's say they're on pasture for 8 hours a day, they still should be able to maintain their weight. So there's got to be something else going on. And I'm going to dig a little bit deeper. All right, so here's just a kind of example diet looking at an underweight senior. I didn't really give you a body condition score, but I'm just using 900 pounds for illustrative purposes. So if I'm going to feed him 2.5% of his body weight in a typical grass hay that's 92% dry matter, I'm going to have to give him about 25 pounds of that soft grassy hay. I'm looking for soft grassy hay, right? I want something that he can chew easily. That usually those soft grassy hays tend to be a little bit higher quality. We know that color is the most misleading aspect of hay when we do visual analysis, but if it's soft, at least they'll be able to chew it, digest it, and hopefully utilize those nutrients. And again, I'm going to spread that over the course of 24 hours. We haven't really gotten into hay nets. I've had some pictures up, but hay nets are a great way to do that. And then I'm going to start with a pound of ration balancer twice a day. And I'm going to, slowly make these changes, and then I'm going to evaluate. And I usually use 30 days as a benchmark. So once I've got the horse on the diet, the full diet that I want it to be on, then I'm going to give him about 30 days, provided he's not like a body condition score of 2, to see the change. And if he is not gaining weight, he's not gaining in body condition, then I'm going to consider, like, do I need to add supplemental feed? And so that can look like any one of these. I'm not saying we're doing all of these together. I'm saying I might consider adding alfalfa pellets, or I can add grass hay pellets. It doesn't have to be alfalfa, but I'm going to look at a pelleted forage, and I'm going to think about doing that maybe 2 to 3 times a day. I could alternatively use a senior feed. Now, if I'm feeding a pound 2 to 3 times a day, I'm not meeting the minimum that the bag tells me I need to meet in order to have those nutrients met. So if we're underfeeding a feed that needs to be fed at a minimum of 6 pounds a day, then I'm going to keep the balancer while I'm adding the senior in. If I get to a point where I'm feeding 6 pounds a day, then I can take the balancer away because all the nutrients will be met in that senior. And that's a really important concept. So underfeeding those complete feeds, if you're not using a balancer as well, you are shorting the nutrients. So read those labels. They will tell you what the minimum feeding rate is. And then I can also use that good old beet pulp. So that nice prebiotic fiber. And again, I could start with a pound, and I could go 2 to 3 times a day to get a good quality fiber into that horse, calories. They're still chewing. So we're meeting those needs for grinding. That's going to produce saliva. That's going to be good for oral health. That's going to be good for gastric health. So I want that horse chewing. So fiber is where it's at. And then I can add supplemental fat as well if I need to. All right, if the horse is on pasture and just thin, doesn't have other issues, we might simply be able to just meal feed one of those options I outlined there. So I might say, I'm just going to throw some hay pellets in, or I'm going to throw in, some long stemmed hay if they can still eat it. So I might just need to supplement pasture with one of those other options. All right, poor dentition. So horses that have dental issues, and it depends a little bit on what the issues are, can usually still do just fine on pasture because the grass is soft. They can usually manage to chew it and get it down. In some cases, I might go from a long stemmed hay to a chopped hay, but that's going to be on a case by case basis because if horses have um, the spaces in between their teeth, the technical term is diastemata. The chopped hay can get really packed up in there, and that's not beneficial. And depending on the grinding surface, their grinding capacity, sometimes even chopped hay doesn't, it's still too long and they are quitting it and they're not really getting the nutrients out of it. So this is where I'm going to consider going to an all complete feed or all hay pellet diet. And I can throw some beet pulp in there as well. Now, this is a question that comes up more and more, I feel like, in my practice, and that is when do we remove long-stemmed fiber, long-stemmed hay altogether? And I think it's coming up more because horses are living longer and they're outliving that grinding capacity. So it's a good problem to have on one hand. But when to do it is when your veterinarian tells you, like, there's no grinding capacity and your horse is at really high risk for impaction colics and chokes. Um, so if your horse is having those episodes, or your horse has diarrhea or fecal water syndrome, and you haven't had an oral exam, make sure you get an oral exam. So we want to make sure that we get in there and really evaluate what's going on. And for many horses who are living long enough, we're getting to this point where long stemmed hay has to come off the table. How do we do it? It's not easy. So this is not an easy way to feed, and I feel badly when I recommend it, but we're going to separate these horses. Pasture generally is still okay, but we're going to replace long stemmed hay pound for pound with a hay product. A pellet is my preference because, as I said, cubes oftentimes don't soak up soft enough. So we'll do a hay pellet, or we can do a complete feed, or I like a combination because I think horses get bored with these diets. So sometimes giving like half and half hay pellets and senior or complete will at least keep their interest a little bit. And then again, making sure that we're not feeding less than the minimum on the label when we're using those complete feeds or adding a little balancer. And generally speaking, when we're making this transition from no long stemmed hay to a hay pellet, I'm going to make it slowly because if you just take long stemmed hay away and go straight to pellets, many horses like just lose the will to live. They just can't take it. So we don't want to torture them. We want to do this slowly. So take away a portion of the hay, and then over, 7 to 14 days, we're going to slowly transition to all pelleted hay. The exception is if we have a hospitalized colic, we might refeed that horse just with pellets and we never go back to hay. All right, so here's an example, and I do want to get to PPID, so I'm not going to spend a ton of time here. But this just walks through if we've got a horse that's 1,000 pounds, that's in good body condition, just has really poor teeth, and we need to take it off hay, and it's not already on pasture. We're just going to take that 2% of its body weight, and we're just going to feed it in either pellets or complete feed, or in this scenario, I gave you half and half. And the trick is that we have to spread this out over a minimum of 4 meals a day because we really don't want to feed more than 5 pounds in a meal. And we want to get that horse, eating over that 24 hours, still trying to trickle feed. And then soaking is really important. Some horses will still bolt this feed, and so we need to take precautions. So that can be wetting the feed, especially if there's beet pulp in it, or putting big stones in a shallow feed pan so that they have to work around it and eat slowly. Because it is so boring, many horses will figure out how to just graze on the pellets, but it does take, separation from its herd mates. And so there are a lot of tricks and tips to doing this, but it's a challenging way to feed. And as you can imagine, it's not the most economical way to feed either. All right. PPID, or pars pituitary pars intermedia dysfunction, also known as Cushing's. I think more and more people are familiar with this because it's an age-related disease, and we have horses living into old age, so we're seeing more of it. The classic presentation is this long, shaggy hair coat that's really slow to shed or eventually just doesn't shed out at all. This is late stage, so we can have a lot of other symptoms earlier on, like skin infections, delayed wound healing, some of the muscle wasting, especially over just the top line. They'll get kind of bloaty looking. And then with PPID, we can get insulin dysregulation, which often leads to laminitis. And as I said in the very beginning, I really hate laminitis. So I really enjoy helping people figure out how to feed these horses to hopefully prevent laminitis. The feeding isn't necessarily going to change the PPID, but it can change some of the outcomes from PPID. So our diagnosis is there. We're going to treat these horses with pergolide. And then if they don't have ID, so ID is insulin dysregulation. You can also use IR for insulin resistance. There's semantics, but we want to treat the horses. We want to, again, maintain that good healthcare routine, work with your farrier to make sure that we've got good corrective trimming. Maybe it's not corrective yet at this point. It would be once they develop laminitis. But make sure that we're keeping those feet on a regular schedule. We don't want to have anything that's pushing that horse over the laminitis edge. And then pasture is controversial. If the horse has never demonstrated insulin issues, they've never had laminitis, pasture may be okay if they're not overweight. But I would strongly encourage a grazing muzzle. And I would consider, how you maintain your pastures too. So having them a little bit taller allows them to nibble the tops of the grass where the protein is, and they don't get down to the bottom where the glucose is stored. So if they're overweight, I recommend getting them off the pasture, and then get a hay analysis so that you know what your starch and sugar levels are in the hay. These are a couple examples of muzzles. We're all familiar, I think, with the kind of basket muzzle. These are a little bit different. The top one is the flexible filly, and the bottom one is the green guard. And the one thing you have to watch out for and check on their websites is compatibility with automatic waters. I believe the green guard is not compatible with Ritchie waters, so make sure you've got one that they can drink with. But some horses find one more comfortable than the other. And I like these because they're a little bit more breathable and they're pretty light. So one question that came up was like, how do you know what a low NSC balancer is? And there isn't really a good hard guideline right now for these horses that have PPID that are not insulin dysregulated. So we talk about like a moderate NSC. And again, you want to get the numbers. So most of like the big three, so Triple Crown, Purina, and Nutrina, their ration balancers are between 10 and 15% NSC. And when we're feeding, a pound of that twice a day, that's okay, as long as our forage component is low NSC. So we want to stay, below 20% for sure. I would say, even if we could target like more of a 15%. So this is not insulin dysregulated. When we get to insulin dysregulation, we have to pay even more attention. So modifying, for lots of top line, thinking about protein, thinking about vitamin E, exercise them if you can. It's going to improve their insulin sensitivity. They'll lose weight and build muscle. And then really watch all the sneaky sources of sugar and starch in the diet. So even though they don't have insulin dysregulation yet, we don't want to stress that pancreas and push them over into insulin dysregulation. So watch the treats, watch those high NSC feeds, oats, corn, cereal grains, horribly high, and watch those pelleted fats. So if you've got a lean horse with PPID, and they do exist, those fat supplements, stick with oils or like a ground flax. Oops, I might have lost my horse with laminitis, PPID. If the horse has laminitis or a history of laminitis or has insulin dysregulation, 10% is our number. So we want to keep our forage at or below 10% non-structural carbohydrates. And in a slide or two, I'm going to give you the resources for that. So in summary, horses are living longer, they're living better lives, and old age is not a disease. So we just really need to make sure that we're watching for those age-associated changes and working really closely with your vet, your farrier. If you need help with nutrition, there are nutrition advisors out there. Some are associated with certain feed companies, others are not. Get your hay analyzed and weigh everything. And then feed forage first and make sure that they've got water and white salt. So how the horse is fed is just as important as what. Read those labels and call the companies. If you need information that's not on the bag, call the company. I'm a royal pain. I'm calling them all the time or emailing them or reaching out to their customer service people. I want numbers. I want information. And if they can't provide it, then I move on and I don't really go for those feeds. I try to feed things that are very transparent in those numbers. Sure, I'll just go back one slide. These are the books that I really like. So the one on the far left, the Applied Equine and Clinical Nutrition is my favorite. It's pretty, there's some chapters that have a lot of detail, so it might be more than you're looking for. I just purchased this middle one, hardly cracked it. So I can't really say if it's thumbs up or thumbs down. It probably can't be down, probably thumbs sideways. And then the NRC, where you find the nutrient requirements, I think is a really helpful book, and there are tables in the back that go through those requirements. And then the last slide, I'll leave it up so you can screenshot it, take a photo, write things down. Not an exhaustive list by any means, but just some web-based resources for you. Some are companies, some are, the very last one is the Equine Endocrinology Group out of Tufts. And that's where the PPID and metabolic syndrome recommendations come from. So if you want a more technical resource, that's that. And the Healthy Horse app, yes, Purina sponsored it, but it was made here by the Extension Service. And it's a great way to weigh horses, especially when you have ponies and minis or draft horses, things that don't fit like a normal, easy measurement system. Okay, I'm done.
Thanks, Kerry. That was wonderful. So we have some pre-submitted questions first. We'll do just a few considering time tonight, but we'll definitely link out to these resources you've included here in the follow-up email after tonight.
Great.
Which will include the YouTube link to view this talk and then the direct links to view these as well. So question we have, a number of people asked this in the pre-submitted questions here, asked you to address anything about fecal water syndrome. Is that common in older horses?
It is common. And I don't know if it's becoming more common or we're just getting better at recognizing it. And sometimes when things get a name, then all of a sudden, these cases come out of the woodwork. They're super frustrating, and I think we're getting more research getting published on it now, but a couple of years ago, there were only like 2 papers out of the UK on it, and they weren't super helpful. And what we know, or we think we know right now, they've done microbiome studies, and those are challenging to do in horses. So I would still leave room for new data to come down the road. But right now, we don't think it's a microbiome issue. So probiotics don't tend to help. They're not going to hurt, but they don't tend to be the answer. At least here in Minnesota, we tend to see it in older geldings. It tends to only occur in the winter. When those horses go back out on pasture in the spring and summer, it goes away. So the pattern seems to be the common denominator when horses come off pasture here in Minnesota, they go on to long-stemmed hay. And what has worked the best for me is putting them on an all pelleted diet, which makes me very popular because people love to feed an all pelleted diet because it's so easy and cheap. But even if you can do like minimize the long stemmed hay and incorporate, equine senior or a complete feed or hay pellets to try to offset the long stemmed hay, I think you can get improvement. But so far, we don't have a silver bullet for fecal water syndrome. So I'm sorry for those of you who are dealing with that. It's really hard.
Thanks, Kerry. Change of topic here. Someone asks about donkeys, mules, and horses. Um, Potentially engaging in coprophagi, is that eating feces in the winter? Just wondering if that is a concern or indication of any diet deficiency.
It can be. So I think the prevailing thought is horses. So in foals, we think they eat their dams manure as a way to establish their gut flora, but in adult horses, we generally think that maybe they're not getting enough forage in the winter. So they do it when there's no pasture available. It can be boredom. We don't know that it's tied to any one specific nutrient, but maybe just more of a fiber issue. So making sure that those guys have enough forage. One rule of thumb, if they're, in a small area, especially, is to have, like, when you put out the hay piles, if they're fed that way, have one more pile than the number of horses. So there's always some place to go. And trying to maybe do hay nets or find some way to stretch out the hay so that they've got fiber more frequently throughout the day and see if that resolves it.
Thanks. Probably time for two more. This is a general question. How can I go about getting my hay analyzed for sugar content?
Ooh, that's a great question. I love that question. So a lot of the feed stores have nutrition consultants that can come out and do that for you. I don't know anyone that like loans out hay probes. I do a lot of hay analysis at West Metro, so Equine is where I send mine, and they have nice instructions on how to sample hay. So if you wanted to do it yourself, you could go on there and look. It's, you know what, I'll add it to the resources, so it'll go out in the email.
Great, thank you. All right.
Mhm.
Last question here. Yeah, no, is there any foods or any other diets to avoid for arthritic horses? Foods that might add to inflammation.
Um, I would say, I tend to just advise in general, avoiding the cereal grains that are really high in starch and sugar. So I would avoid like a sweet feed. Um, but really maintaining a healthy weight is going to help those horses with arthritis if you can. And it can be tricky, right? Because they can't maybe exercise as well as they used to be able to get the weight off. So working on providing, a low calorie forage, and that's where hay analysis will help to try to get some weight off. But I don't think there's any one feed that's really like super inflammatory.